Welcome back to the Command Your Brand Show. I am your host, Jeremy Ryan Slate, the CEO and co-founder of Command Your Brand. We help our clients to make an impact on some of the biggest podcasts out there. You can check out our free brand authority analysis over at commandyourbrand.com/analysis. And I'm very excited. We have an awesome guest with us today, Dr. Melissa Miskell. And we're really going to be looking at, in a lot of ways, how modern medicine has failed women, and how Dr. Miskell is really helping to really change that paradigm. So I'm really excited to chat about that. So Dr. Miskell, thank you so much for hanging out with me today.
Hey, I appreciate it so much. Thank you for asking me. You're absolutely right. There are so many misconceptions out there that have affected women's health, and I would love to be the bearer of all that news.
Well, so before we get into our conversation, could you just give the audience a little bit of an idea of your background and who you help?
Sure. So I have been a board certified obstetrician gynecologist for 25 years and also in private practice for that long. I started medical school a little bit late at 30 years old after graduating from Texas Tech and then starting a family. So I went to med school a little bit late, but then enjoyed obstetrics and gynecology so much. Ended up having 2 more children in medical school. Wow. And then became chief resident. And so that's kind of my medical story.
Well, I want to kind of key in on the story that happened for you in medical school to kind of start us out. And you had an advisor who told you you'd never make medical school. So I'd love to hear about that story and kind of what drove you to prove her wrong.
Well, that's absolutely true. When I was in undergrad, I had always thought I would go to medical school. And in the conferencing with who was supposed to be my mentor, she basically told me I would never go to medical school. Unfortunately, I believed her and went on a different route. After graduating with 2 degrees in science and got a master's. And then I became a drug rep and did that for a bit. And then life changes and I needed a job that was more secure. So at that point, I thought about going to law school or medical school. I knew I didn't want to get a PhD because I had already worked in a lab and that was not for me. So
I applied to one PhD program, which was NYU, after getting my master's, and I didn't get in, which I guess meant I didn't want to pursue it hard enough.
Yeah, absolutely. I worked in a lab, a biochemistry lab for 4 years, and that just was not for me. So I ended up applying to medical school, getting in, and then did my residency back at Texas Tech, where this lady was now at the medical school. And so when I was in my last year of residency and had been elected chief resident, I went into her office and introduced myself and told her that she told me 8 years ago that I would never go to medical school and that I was the new chief resident for obstetrics and gynecology.
How did she react to that? How did she react to that?
She was dumbfounded, actually. But literally, I left before I allowed her to say anything.
I think that's interesting, though, because I think sometimes, and I think it shows a lot about the type of person you are, right? Like for a lot of people, that'll discourage you. It'll cause you not to pursue it. But for you, you saw it as something that made you want to look further and work harder.
Yes, it definitely was a life-changing moment for me.
So I want to talk about kind of what's happening in the aging world with women, because a lot of times women are told to accept normal aging, and you've really looked at that and said that's not how we're going to do things. So what's the alternative to how hot flashes and menopausal issues are hurting women right now? Like, how are you looking at that differently?
Well, hormonal changes are getting a lot of press right now. The FDA actually just yesterday pulled their black box warning label from estrogen and progesterone. Mm-hmm. So the thoughts behind those hormones are drastically changing. But for years and years, since the Women's Health Initiative trial in 2002, which has been debunked, it was a terrible trial and should have never been published, women have been told that you just got to deal with it. This is your lot in life, and you just need to figure out how to live with those hot flashes that drench you in your board meeting, or the insomnia, or the lack of sex drive. All of those things we've always been told since 2002 to just deal with. Um, and that kind of mantra is all changing now. And women should be listened to. They should not have to go to a physician that says, oh, this is normal, menopause is normal, and you just need to figure it out. That is not the case. There are many avenues that women can take now.
So I guess when you're looking at that, then what are the alternatives? Like how do women handle it differently? Like, obviously, I don't have the personal experience, but I have lived with seeing my mom go through menopause and other people in my life, and really seeing some of the difficulty they were having. Like I my mom suffered from migraines, so that was kind of really was, I guess, later in life they figured out that was a hormonal issue related to a lot of things that were going on. So I'm curious. How do we look at this differently then? If this bad information was given to us in 2002, like what are we doing now?
Well, now we know there's been so much research that's been done since then. And we understand that women actually have 3 hormones that are very important to work synergistically together: estrogen, progesterone, and testosterone. And so we understand that these hormones in the correct combination will actually improve hot flashes, vaginal dryness, mood swings, insomnia, mental fog, all of these things that women have to deal with. But more importantly, as well, is the thing that these hormones do that women have no idea they're affecting, which is your heart health, your bone health, and your aging brain. So any kind of dementia, Alzheimer's. So these
Wow.
hormones are actually very beneficial in so many other ways.
So I'm curious, because you're talking about bone health, and I know this is a little bit of a, like, I guess, off the main point here, but I know in aging women, like osteoporosis has always been something that's brought up. Is that one of the things that's also related to what you're talking about?
Absolutely. Osteoporosis occurs when estrogen drops. So there are 2 types of cells that your bone makes: cells that build up bone and cells that break down bone. As estrogen declines, the cells that break down bone vastly override the cells that build up bone. So that's why osteoporosis is so prevalent in postmenopausal women.
It's really interesting.
Yes. Actually, the thing that's the most interesting to me is heart health, because the number 1 killer of women is heart disease, not breast cancer, not colon cancer, nothing like that. It's heart disease. And so that is something that's swept under the rug for women. Everyone thinks that men die of heart disease. Women die just as much from heart disease, which occurs after menopause, because estrogen is so protective for cardiovascular health.
Can we talk a little bit about that? Like, how do those hormonal shifts affect the heart? Because this is, for me, this is new news. Obviously I'm not as ingrained in your world as you are, but this is new news to me.
Right. And so a lot of it has to do with inflammation. As estrogen declines, inflammation increases. And so that is one of the main problems with heart disease. The other is plaque. And so that's another thing that estrogen does, is it decreases the amount of plaque that builds up in the heart. And so as estrogen declines, all these things that affect the heart and affect heart disease and cause heart attacks are going to be accentuated because of the decline in estrogen.
So I guess when we're looking at this, then, if someone's hearing this and they're like, yeah, this makes a lot of sense to me, this is something I need to take a look at. What does the process look like to handling something like that? I imagine you'd have to know what someone's baselines look like, and kind of where they're at. But what does that process to actually starting to take control of this look like?
Right. And so the most important thing, obviously, is to find a physician that will listen to you. That's the number one thing to do. And then from there, that physician is going to draw your levels of your hormones, probably look at some other blood levels as well. If you're postmenopausal and haven't had a period for several years, then your hormone levels are all going to be flat. So then it's important that you are speaking with a physician that is willing to help you with that, whether it's a hormone replacement that is oral, topical, or injectable. That is a conversation between the patient and their physician. There are several different ways to do hormone replacement, and every way is not for every person. But the hormone regime that you pick should be structured for you. Every woman's different. It's not one size fits all.
Mhm.
And so, off of her symptoms, along with whichever modality they choose to do hormone replacement, then they should design a replacement that fits that woman specifically.
So I guess let me ask you this then. So you have an idea of where you stand. You mentioned that there's various options. I'm curious, what are the most prevalent? What have you seen as the most effective? What's kind of the best way to confront this from, I guess, kind of some of the tools we have?
Right. So, in my practice, we do injectable hormones. Estrogen and testosterone are combined into an injection that's given once a month to women, and progesterone is given by mouth every night. So we have found that this works incredibly well because you can tailor the injection to specifically fit each woman individually based off of their symptoms and their blood work. We draw blood again every month to tweak the injection a little bit, depending again on the woman's symptoms. And then from there, once she's on a stable dose, then she doesn't have to get her blood drawn, but every 4 to 6 months. So the other ways to do hormone replacement would be oral, which is the least likely form that should be used just because it then goes through the liver. And we really don't want to stress our organs more than we have to. Topically is another way that hormone replacement is done, but again, that's very difficult to regulate. Everybody absorbs differently. And so, what we found is that the injectable form is the best.
I'm curious, and I may be totally off base here, but does the bioavailability when you're taking things orally have something to do with it as well? Because I know also you mentioned the liver, but things change as the body breaks them down. Does that have something to do with it as well?
Absolutely. And again, everybody's going to absorb differently through their gut. So, using an oral form can be actually the most difficult one to regulate.
That's really interesting. So I'm curious then as well, there's newer technology out there like patches and things too. Um, what does the prevalence look like in using things like that?
Well, a patch technically is just transdermal, so you're absorbing it through your skin, same as just an oral application of the hormones. So, again, it's going to be depend on the woman and how she absorbs, but very difficult to regulate. The other form that a lot of people know about are called pellets. The pellets are inserted in the soft tissue of the hip about every 3 months. Again, once they're in, you cannot get them out. And so you have to just kind of deal with however those pellets are going to affect you hormonally.
That sounds a bit invasive too, is it?
It is, but for some people, the convenience of every three
Sure.
months is something that they're interested in.
So I'm curious as well. Like obviously, I want to talk about in a few minutes, like some of the changes that people might see from properly handling this. But I'm curious too, and we see this with lots of different conditions that there's sometimes symptoms that we don't realize are symptoms. And I guess when women are looking at handling these sort of situations, what other sort of symptoms are they seeing? Are there things related to sleep? Like, are there other things happening in their lives? What are other things that could be occurring that maybe they weren't realizing was part of the issue?
Mhm. One of the number one things, I mean, insomnia is always in there, and a lot of women will kind of realize that, but it's the brain fog that really is something that women think that they're just getting older and it's part of aging. And now they can't remember the things that they used to. They used to be able to remember every kid in their classroom and their neighbors, but now they're like, what's that kid's name? I can't remember. And so that type of thing is really one of the number one things that affects women that they don't realize is hormonal.
So when we're looking at, I guess, getting the right treatment here, like obviously this isn't medical advice, but we're having a conversation about, how these things can be confronted. When we're talking about that process of starting on hormones, is there kind of, some initial changes, like maybe we need a little bit more of this or this isn't as effective? Like, I guess, how does that work in terms of, finding what's right for the person?
Absolutely. It does take a little bit to get the right dosing. At our practice, we have you get your blood drawn before you actually see a provider. And so when you come in for your first appointment, that provider has your blood work already, talks to you, finds out what your main symptoms are, concerns are, and then designs an injection for you that you get that day. So that's kind of what we do. We have you feel better from day one. And then from there, you're going to draw their blood again and just look at how you can tweak the estrogen and testosterone. A lot of it is based off of their symptoms. So we don't just go by blood work. So if she's still having hot flashes that are affecting her in her daily living, teaching her class, if she's attending patients, she's a nurse or whatever, then we need to increase her estrogen. If she's having trouble sleeping, then we might want to increase her progesterone. If she's concerned about an increase in acne, then we might want to decrease her testosterone a little bit. So it's a matter of listening to the patient as to what their concerns are, because not everybody's concerned about having a little bit more acne because their sex drive is so much better. So it really depends on the patient and what their concerns are.
And I guess when we're looking at, the hormone combinations that are being used and things like that, you've been doing this a long time. You have a lot of experience with it. I guess, is there one thing that you're seeing women are needing more than the others? Or what does that kind of look like? And also, when we're looking at things like environmental causes, I guess, what effect are those having on it as well? Because even, the chemicals we use in our daily lives are changing a lot. What do those things look like?
Well, there are a whole group of chemicals called phytoestrogens, and those are in exhaust fumes. So anytime you smell a fume from a car, then you're being exposed to a phytoestrogen. And the most important thing, they're in every plastic that there is. So every plastic water bottle that you're drinking out of, you're being exposed to phytoestrogens. And those estrogens work, they're they work against what your natural estrogen will do. So they will block some receptors, but they don't give you the benefit and relieve your symptoms. So there are quite a few environmental estrogens that are out there affecting us.
So I guess when women are looking at that, do you give them advice around maybe changing the type of water bottles they're using or what they're storing their food in? Because I know my wife has always been big on, we always drink out of glass bottles and we always store things in glass because of the things you're talking about. So I'm curious, is that also something you're looking at, maybe helping people make some environmental changes too, so the work you're doing with them is more effective?
Absolutely. We will give them a list of things that we would like for them to try to start eliminating. And a lot of those, just like you said, you should never actually heat food in your microwave in plastic. That's one of the
My wife freaks out about that. She's like, no, not the BPAs.
exactly. Yes, and I have a dear friend who drinks water out of plastic bottles, and she's like, "Well, but I recycle," and it's like, no, that's not good enough. Just get rid of the plastic in every single way that you can. So, and a healthy, clean living diet is also super important to stay away from any kind of saturated fats and those types of things is also a super important thing for your health just in general.
So I guess let's talk about that a little bit too. And we're looking at dietary changes, like what kind of dietary changes should we look at? You mentioned saturated fat, but I guess what other dietary changes should be looked at so that your treatment's more effective?
Right. A lot of times we try and get women to stay away from soy. Soy also is an estrogen, plant-based
That's
estrogen.
interesting because they tell those of us men that we also should not be taking a lot of soy as well.
Right, exactly, because what it does for men is it actually blocks your testosterone, and so it will keep your testosterone. It'll actually force it to change into estrogen, and so that's why soy, tofu, those types of things are should actually be taken in moderation as much as possible, unless you're getting it and you know that it's completely organic, then because most of what's grown in the United States is not.
Yeah, I do enjoy my bread more when I'm in Europe because
Yeah,
I kind of realized that the wheat wasn't created in a lab somewhere.
exactly, exactly. So,
Well, I guess when we're looking at treatments that are successful, like what sort of changes do women see? Like what kind of changes in their lives do they see?
well, the most important thing for us is when the husband comes in and says thank you. That way we know that we've done our job. But for women, it is amazing. I mean, literally within days to a couple of weeks, they will see a difference in their sleep. I mean, hot flashes are one of the number one things that affect most women. Their sex drive will improve, their mental clarity will improve. It really is life changing for these women who they're just miserable and they think, I've got another 30 years because that's what our aging is
Sure.
now. We go 30 years but beyond menopause as an average. And,
Wow.
they're like, I'm going to live like this for the next 27 years. Are you serious? So it's life altering.
Absolutely. Well, Dr. Miskell, I've really enjoyed this conversation. For people watching, if they want to find out more information, if they're interested to see more about what Hormones by Design does, how can they contact you, or how can they find out more about how you can help?
Sure, they can go to www.feelbetterfromdayone.com, and we have lots of educational information on there. There's a little quiz that you can take to see kind of where you fit into menopause if that's interesting to you, and then they can reach out. We can contact them from there.
Absolutely. So I've really enjoyed this conversation. With those of you out there listening, reminder to check that out because, Dr. Miskell is definitely one of the best at what she does, and she's very passionate about helping women, which I think is awesome. And so those of you out there watching, reminder to like this video, leave us a comment, and also smash that subscribe button if you want to learn more. Thank you so much for joining us today, everyone, and have a good one.